If you or a loved one has cancer but feel lost, and you don't understand the diagnosis, the treatment options, the side effects of treatment, or have other questions on your mind, then Online Oncology is the best place to find the right answers. Through a series of videos, we will help you every step of the way. Now let's get started with today's topic.
Welcome everybody, this is Dr. Riaz with another episode of Be Smart, Fight Strong series. Today the topic is how to prevent cancer. There is no foolproof way to prevent cancer because the cancer starts within the body, and sometimes there are no identifiable risk factors that can cause cancer. However, we all can take some measures to decrease the risk of cancer. So the first risk factor that we can eliminate from our life is the use of tobacco. Now, tobacco use directly or indirectly has been linked to each and every cancer. Therefore, stopping the use of tobacco can decrease the risk of a lot of cancers by more than 100-fold. The most common cancers that are linked with the use of tobacco are lung cancer, pancreatic cancer, liver cancer, colon cancer, bladder cancer, and kidney cancer. But even other cancers have linkage to the use of tobacco. The good news is that the use of tobacco overall is declining in the community. Hence, we are seeing the results of that because the incidence of certain cancers is decreasing, and the reason for that is less use of tobacco in the community. Second is diet. Now, diet is linked to development of cancers, and that's the unhealthy diet which can cause obesity. So the diet high in carbohydrates and fats can lead to obesity, and obesity is linked to a lot of cancers. Therefore, adopting healthy dietary habits can decrease your risk of cancer. The use of pickle has been linked to development of esophageal and stomach cancer. Therefore, limiting the use can theoretically decrease the risk of those cancers. The next is the physical activity. Increased physical activity and daily exercise has been proven to decrease the risk of several cancers. Therefore, we all should be adopting a healthy lifestyle where there is at least 30 minutes of exercise every day. If not every day, at least 4 to 5 times a week is what the experts recommend. The next measure, and that is linked to one of the sections I covered with the diet, is the weight control. You need to be in your ideal body weight, and your BMI, which is a body mass index, should be below 25. Body mass index is calculated by looking at your height and weight, and then there is a formula which is available on Google, so you can just Google it, plug in your height and weight, and it will tell you what your BMI is. Ideal BMI is between 20 and 25. So if you are over 25, you are technically overweight, and above 30, you are obese by definition. Therefore, keeping a BMI within the normal range, which is 20 to 25, is an excellent idea, and it will reduce the risk of developing cancer. The next measure that we can take is limiting the alcohol intake. Alcohol has been linked to several medical problems, and several cancers have been linked to excessive alcohol use. Some of the common ones are esophageal, stomach, liver, and pancreatic cancer. Everything in moderation is a good idea, and excess of everything is bad. Therefore, limiting the alcohol use can decrease the risk of developing cancer. The next item I have on my list is the limiting the sun exposure, and that is especially important for skin cancers. There are several types of skin cancer, and almost all types of skin cancers risk increase by excessive sun exposure. I practice in the state of Texas, and we have a lot of sun in this state, and I have a lot of farmers as my patients who have developed skin cancers. Among the skin cancers, melanoma is the most deadly cancer. Therefore, wearing full sleeve shirts, wearing a hat in summer, and covering all the exposed areas can decrease the risk of developing skin cancer. The next risk factor is the radiation exposure. And radiation exposure can be from several different sources. Sometimes people who have childhood cancers have received radiation as a part of their treatment. And the area which is radiated theoretically has an increased risk of developing cancers. Radiation exposure increases the risk of cancer down the road, and people need to be monitored for that. For example, if somebody has a radiation to the chest when they were a child, and now they are grown up, need to have surveillance for breast cancer and lung cancer, because their risk of developing breast cancer down the road is high. In fact, the standard guidelines are to start doing mammograms in those women who have chest radiation 10 years after they complete the radiation. Then there are several other sources. If you are close to a place where some radioactive waste has been dumped, if you are in a healthcare setting and you are working in the radiology department, you need to wear the lead shields to protect yourself from exposure to radiation. The next item I have on my list is the exposure to lead and asbestos. The good thing is that in this day and age, the exposure to lead and asbestos is very minimum to none, and the only way you can be exposed to them is in the old buildings. Old buildings have lead pipes, and the paint they use in the old buildings has asbestos. Certain occupations, like if you are a painter, if you are into renovation of homes, if you are into demolition of buildings, then you need to wear the protective gear, because the old buildings may still have lead pipes and a lot of asbestos in the paint. And if you get exposed to that, then your risk of developing cancer, especially lung cancer, is high. But asbestos has been linked to several other cancers like mesotheliomas too. The next very important item that I have on my list is the certain chronic infections that increase your risk of developing cancer. Some of the common examples of these infections are hepatitis B and C, which increase the risk of developing liver cancer and the cancer of the bile ducts that take our juices from the liver to the intestines. Hepatitis B and C have also been linked to developing pancreatic cancer. Then HIV increased the risk of several different cancers because it compromised the immune system, and we know that a compromised immune system increased the risk of several cancers. Then human papilloma virus infection, HPV, can increase the risk of developing head and neck cancer and cervical cancer in women. Epstein-Barr virus can increase the risk of certain lymphomas and nasopharyngeal cancers. Therefore, chronic infections need to be identified and need to be treated to decrease the risk of developing cancer. Now, talking about the other measures that we can do to decrease the risk of cancer is by vaccinations against these viruses, like a vaccination for human papilloma virus, which is now recommended for both boys and girls. These vaccinations have proven to decrease the incidence of development of cancers in both boys and girls. Vaccination against hepatitis B and C can protect you from catching the hepatitis B and C infection and hence decrease the risk of development of liver cancer from those infections. Other strategy that we can do, although this is not a strategy to prevent or decrease the risk of cancer, but it is a strategy to detect the cancer at a very early age when it is really treatable and have the highest rate of cure, is by going through screening procedures. Like for breast cancer, we have mammogram. For colon cancer, we have colonoscopy. For lung cancer, we have low-dose CT scan of the lungs to screen patients for that. Now remember, these modalities are not going to protect you from having cancer. However, if you are destined to have cancer, they're going to detect it at a very early stage when the treatment is very effective, very simple, and the cure rates are very high. And don't forget to watch my other video about all the screening modalities you can do for different type of cancer, and I will be talking in more detail about all the screening tests we have for different types of cancers. Thank you very much.
We hope you find this video helpful. The more knowledge you have and the more informed you are about your condition, the better decisions you can make about your health. Please spread the message to other people that may also benefit from this knowledge. We have covered several topics about cancer care in other videos. To learn more about these, visit our website, www.onlineoncology.com. You can also visit our Facebook page, YouTube channel, Instagram, and follow us on Twitter on onlineoncology.com. Be smart, fight strong.